Starting, all attendees are in listen-only mode.
Good morning, everyone. Thanks for joining us today for our webinar. My name is Carmen Boone, and I'm an education coordinator from Oregon Pacific Area Health Education Center. We're a hosted agency of Samaritan Lebanon Community Hospital. Our agency mission is to promote access to quality healthcare through community and educational partnerships. Today, I'll be your host and moderator, and we'll have two guest speakers with us. Let's go over some housekeeping items. On your GoToWebinar control panel, you will notice that all microphones are muted. They'll remain muted during this session. Please use the questions menu and type your questions and comments at any time. We will be monitoring them throughout the presentation. The slides can be downloaded from the handouts menu. If you have any trouble downloading them, send us an email and we'll send them to you. This webinar is being recorded and will be available on our YouTube channel. If you have any questions, please send me an email at carmenb@samhealth.org. Now, to obtain CME and CE credit or contact hours as a certificate of attendance for this activity, you must log into www.eeds.com and enter this activity code. Please write it down for your records and consider that the activity code expires within 1 week. One thing to notice is that we will email you all these instructions and links today within an hour or two after this webinar. This presentation is jointly provided by Samaritan Health Services, Oregon AHEC, and Oregon Pacific Area Health Education Center. And thanks so much for being with us today. The presenters and the planners of this activity report that we have no conflicts of interest or relevant financial relationships with any commercial entities that might affect the contents of this presentation. This webinar is presented by Itai, Jeffries, them, they, y'all. They are a TwoSpirit researcher, educator, and equity consultant, and a co-manager of the Path Remember project. And we also have today Morgan Thomas, they, them, who is a writer and settler from the Gulf Coast and co-manager of the Paths Remembered program. Now, without further ado, I am happy to leave you with our presenters. Just a second.
Thank you so much. And Itai and I are both glad to be here today, and we will be talking today about creating gender-affirming spaces for Indigenous clients. And we always begin these conversations by going over a little bit of definitions and terms to make sure that we're all on the same page. So I'll just begin by talking a little bit about gender. And the definition that we give for gender is that it refers to a person's internal sense of identity, which could be a man, a woman, both of those things, neither of those things, or something else, and also to their social role. And it's important when we think about gender identity that we're aware of both those internal and those external aspects of identity. And it's important also for us to distinguish gender from sex, and also to complicate the ways that we're thinking about sex. And I'll have Itai, if you would just speak briefly to that complication.
Hello, everyone, and thank you for being here. So when we think about sex, it's oftentimes assumed that sex is the thing that is more binary and measurable. And when we think about gender, it's the thing that's more social or broad. But in fact, if we look at sex, we look at the fact that about 1 in every 1,500 births are considered intersex. And we actually look at the definition of sex itself, that it includes internal and external genitalia in combination with secondary sex characteristics, things like body hair and body hair distribution and hormones. We see that actually there's a really broad spectrum of ways that people present in terms of sex in the population. And if we were to line up everyone that we know in terms of those things, in terms of those features, we would just see a broad continuum rather than two categories.
Thanks, Itai. And so while this presentation today is really focused on gender and gender identities and ways of affirming clients' genders in clinical spaces, we will touch briefly on sexual orientation. And so again, just to make sure that we're all on the same page, sexual orientation refers to the way a person describes their emotional, romantic, or sexual attraction. Here, again, it's key to understand the complexity of those three layers and to understand that sexual orientation does not, for instance, always correlate with sexual behavior. So as a clinician, if you are interested, for example, in knowing whether someone should be thinking about pregnancy prevention, asking about sexual orientation doesn't actually necessarily give you the information that you need to make that call. And in those situations, asking more direct questions like, is it possible for you and your partner to get pregnant, would be a more precise way of getting the information that we might need to know clinically, because again, sexual orientation has many different layers within it and doesn't always correspond specifically to sexual or romantic attraction.
Thanks, Morgan. So for TwoSpirit, what we're talking about is traditional ways of understanding gender, or at least ways that are not easily captured by the West. And so anytime you have an Indigenous person who identifies with a gender identity, a spiritual identity, or even a social role, which in many of our communities it is a social role, we can refer to them under the TwoSpirit umbrella. Now, TwoSpirit was a term coined in the early 1990s as a result of ongoing queer Indigenous activism and gatherings. And so when you think about TwoSpirit in its essence, you know that in many tribal nations, we have ways of referring to third and subsequent genders. Some tribes had multi-gendered systems, including up to 9 genders. And so anything that goes beyond those 2 genders associated with the binary, as we think about it today, can be associated with the umbrella term TwoSpirit today. Though some people who identify as TwoSpirit prefer also to go by their traditional role in their language, and some may prefer to use that exclusively instead of using the word TwoSpirit, but we do think of it as a useful umbrella. So for me, I'll just share very briefly that learning the term TwoSpirit was really consequential in my life. And I had joined the Occaneechi Health Circle, which my people are the Occaneechi people of North Carolina. And this was a circle of women who really came together to seek to restore our concept of health, which involves our understanding of our histories, of our medicines, and of our culture. That health is comprehensive of all of those things. And it was while interacting with those elder women that they shared with me the term TwoSpirit for the first time, but also some of our older understanding of what that meant, and welcomed me into that circle, into the Occaneechi Health Circle. And so that was the first point at which I learned about it. And it was really became a home for me in ways that those Western terms like gay or transgender or gender non-binary may fall short.
Thanks, Itai. And so having established that foundation of terminology, we're going to talk now a little bit about the work that the Paths Remember Project has been doing, specifically focusing on TwoSpirit and LGBTQ+ identities and health needs within Indigenous communities. And then we'll talk a little bit about a strategic plan and how those things apply directly to clinical spaces like the spaces in which all of you are working. And we're going to start with that by focusing on an online survey that we completed last year. So the work of the Paths Remembered project emphasizes Two-Spirit and LGBTQ plus health equity. That's what we're working towards. And this survey was designed to give us a sense of the ability to access healthcare within Two-Spirit and LGBTQ plus Indigenous communities, barriers to access, and also, importantly, pride and connectedness. So we'll share some of the data that's most relevant to clinical spaces and affirming clinical spaces. And within this survey, 49% of our respondents identified as trans or gender diverse. All of our respondents were Indigenous and Two-Spirit or LGBTQ, and they came from across the 48 states, Alaska, and Hawaii. When we asked these respondents what word best describes their gender identity today, you can see there on the left, the most common words were Two-Spirit, non-binary, woman, gender fluid, gender queer. Importantly here, 4 of those 5 words are gender identities that don't correspond to a male-female binary. So among these respondents, who admittedly are young, our mean age was 27, most of these folks are in their 20s and early 30s, but among these respondents, gender identities that offer a sense of fluidity and that recognize that gender is not binary were far more frequently reported. Similarly, when we asked about sexual orientation, the most frequent responses were queer, bisexual, Two-Spirit, gay, and pansexual. Here again, 4 of the 5 are sexual orientations that are broad in the sense of what they tell you about someone's emotional, romantic, and sexual attraction. And so we're seeing, again, this recognition that these identities are fluid and expansive as well. I also want to just note that Two-Spirit appears in both of these charts, and to say that that is by no means like a mistake or some confusion over what the word Two-Spirit means. It is rather the fact that Two-Spirit as an Indigenous concept can't be mapped exactly onto settler colonial ideas about gender and sexual orientation, which see these things as discrete and separate categories. That it is within a different system. When asked about barriers to healthcare access, respondents reported 2 barriers most frequently. One of those was difficulty accessing care due to fear that medical personnel would find out they were 2S LGBTQ+, which was a significant or extreme problem for more than half of our gender diverse sample. And the other was difficulty accessing care due to a community fear or dislike of 2S LGBTQ+ people. Again, just over half of our gender diverse population reported that this was a significant or extreme problem. And I want to say here that often we sometimes we'll try to like relegate these to rural areas or areas that we think of as less progressive, and these numbers were continuous and stayed the same even when we broke this up by like rural and urban areas. So these barriers are being reported by people in our urban areas, in our cities, in our large hospital systems. When we look specifically at behavioral health and asked about difficulty accessing psychologists and behavioral health professionals who could help them, these numbers jumped even farther. So we see about 70% of our gender diverse individuals reporting that they are having a significant or extreme difficulty finding mental health care. And we know that this has impacts on mental health. So when we asked about suicidality, over 86% of respondents have thought about suicide, and nearly half have attempted at least once in their life. And these statistics are sort of especially difficult for me to look at and to talk about, in part because we know that this is preventable. A recent, relatively recent 2018 study by Russell et al., which is published in the Journal of Adolescent Health, found that the use of correct name and pronouns across the board in school systems, communities, hospitals and clinical spaces, and at home was associated with a 56% decrease in suicide attempts in trans youth. And similarly, trans youth who have socially transitioned have levels of anxiety and depression that are comparable to those of their cisgender peers. So when they are affirmed in their gender identities and are living in those identities, these individuals are thriving.
Thank you, Morgan. So when we hear those very difficult and heavy statistics, for many studies, for many researchers, the story stops there. there's so much focus on the disparities that we face as a community. And that's not just true for Indigenous queer people, but for Native people overall. So we value in our program and as part of our research, we value the strengths-based approach and also measuring resiliencies alongside some of those measures like suicidality. So in looking for the sources of resiliency, we see lots of interesting measures that we were able to capture in that survey. One of them stands out to me because I'm very familiar with LGBT research as a sociologist myself. And in mainstream LGBT research, it's often found that for people who fall under the LGBTQ+ spectrum, gender identity and sexual orientation are extremely important to one's sense of self. Right? And so here we see in the two middle measures, gender identity and sexual orientation, that it is true that the people in our survey also report that these identities are somewhat or extremely important. But in comparison to our Indigenous identities and to our self-valuation of the history of our own people, we see that they're actually quite low because the importance that we place on our Indigenous identities and on our histories as a people is extremely high. So despite the fact that we're facing these various disparities, that sense of self associated with being Indigenous is extremely high in comparison. So this tells me something about where we might look when we're looking at how to create cultural protective factors, where those protective factors might be, and what are the sources of resiliency for our Indigenous queer people, particularly our gender diverse respondents. Of interest to me as well in this valuation and this importance placed on indigeneity, we also see that people who took our survey are participating in at least one traditional cultural activity. 80% nearly report participating in at least one. And so we know that not only is there this interest in identity, but this real need to be connected to community and tradition. So if we're thinking about interventions, it's really important that we're also thinking about the way that culture can be a part of those interventions in order to bolster that resiliency.
Thanks, Itai. So what does all this mean practically and in terms of advocacy? We're going to shift now to focus on a strategic vision and action plan for trans and gender affirming care in facilities serving Indigenous clients. And I will send that plan also to the moderators so that you all have a digital copy of it afterwards. But the plan focuses on policy, best practice care, affirming physical environments, and systematic support that's needed to ensure that all of our clinical spaces are affirming for gender diverse Indigenous people. And it was created by a group, the Native Advocacy Work Group for Trans Health, in collaboration with the Northwest Portland Area Indian Health Board over about a year. And that group includes clinicians, gender diverse Indigenous people and community members, tribal leaders, and others as well. And Itai will speak a bit about the vision and the policies of the plan.
Yes, and I would also like to say with this that it was created most intentionally for our what we call our ITU healthcare system, which includes Indian Health Service, the direct service units, tribal clinics, which are an act of self-determination, appropriation of those dollars to run your own clinic, as well as urban Indian health clinics. But we really encourage private medical systems as well to take on principles and ideas put forth in this plan. As we know that serving your gender diverse Indigenous patients will also lead to better outcomes for all of your gender diverse patients as well. So some of the guiding principles behind this plan that Indigenous understandings and practices must be integrated in care. So there was a lot of talk around ACA about including behavioral health in the way that primary care was delivered, right? So that integration. When Indigenous patients are concerned, we also want to incorporate culture. The next is initiatives are led by gender diverse people So we don't just want to see improvements in delivery for gender affirming care or for intake or all the other ways that affirming care shows up, but that also we're doing everything we can to employ gender diverse folks, including Indigenous people. The last one is that the initiatives recognize Indigenous diversity in gender concepts, roles, and practices. So this really involves broadening your understanding of the way that gender and sex might be interpreted, along with sexual orientation. And so understanding that here on the land that you all reside on today, that Indigenous practices of gender and other ways of being involving spiritual roles have existed for thousands of years and are actually quite broad in comparison to Western concepts. So when it comes to policy, we can think about these 4 critical components that are absolutely necessary for moving the needle. Any one of them is sort of limited in scope. And so we are working with tribal entities, and tribes are working on their own to pass comprehensive policies to advocate for the rights of our Indigenous queer people, for our gender diverse Indigenous folks in the communities. We have some examples of that. I don't know if we'll get to them today, but we definitely have some examples of tribal resolutions that have been passed. We need policies at the level of organizations, and that's really where you all come in as well. State policy is absolutely critical, as well as national policy. So when it comes to IHS, for example, our Indian Health Service, we need that national level policy to move that needle. But then we think about the ways that urban Indian health clinics are subject to state law. And so all of these are going to be really essential and critical to moving the needle on advocacy. These are just some examples of existing policies that have been passed by tribes and tribal entities. And we'll talk very briefly about some recent news that our program has as well.
Thanks, Itai. And so in addition to those policy initiatives, the Strategic Vision Action Plan outlines a few central tenets of best practice care for gender diverse patients and gender affirming care generally. I'm not going to read all of these, but I just want to point out a few of them. Culturally attuned care calls back to what Itai said about Indigenous, TwoSpirit, and LGBTQ+ people being deeply connected to Indigenous culture and to indigeneity, and feeling a real sense of pride within that. So if we are not providing culturally attuned care, then we're missing out on the possibility of tapping into that sense of pride and self-worth and that can lead to resilience for our patients. In addition, the aggregate data and EHR solutions are really key here. And I just want to highlight the importance of integrating pronoun information and correct name for gender diverse patients into those EHR systems so that individuals are being called by the correct name by everyone that they're interacting with within the clinic. And then last, I would just mention, again, because of the research that we shared earlier, the importance of a commitment to gender affirming behavioral health care. And currently the Northwest Portland Area Indian Health Board, in an attempt to really bolster and build capacity for gender affirming behavioral health care, has worked with a counselor to provide no-cost care to Indigenous, TwoSpirit, and LGBTQ+ people living in Washington, Oregon, New Mexico, Texas, Minnesota, and DC. And we're working on expanding that network, but similar initiatives to ensure that we are able to connect TwoSpirit and LGBTQ+ individuals and gender diverse individuals, especially to affirming behavioral health care, are key. I had mentioned also that the plan focused specifically on affirming physical environments. And within this, what we are working on currently is looking at IHS tribal and urban facilities within Oregon, Washington, and Idaho, and having conversations with those facilities about their current environments, and then working with them to come up with strategies to make those environments more affirming. So we've worked with multiple different tribes as well as clinics to do that work. And anyone can access a a sort of guide to what different environments might feel like to gender diverse patients, and how to make their environments more affirming at the URL link here on the slide, which you'll have when you get the slides later. And anyone can also fill out a self-assessment for the clinical environment in which they work. And the link to that self-assessment is the bit.ly link that you see there at the bottom of the page. And if you fill out that self-assessment and include an email address, then we will connect with you directly to offer tips and strategies and resources that are specifically tailored to the clinical environment that is described in the assessment. The other way to access that assessment here on this slide is to just text the word assess to 97779. And if anyone's interested in individual clinic consultations, those are also available. And then last, I'll just touch briefly, because this is a little bit less relevant to Samaritan as a clinic outside of the ITU system. But we know that clinics and organizations cannot do this work if they aren't being supported by the systems in which they exist. And so the plan is also outlining strategies and needs for grant funding, training, and other aspects of systemic support. And especially, I think, key to this one is thinking about ways that we can actually connect Indigenous, gender diverse individuals to gender affirming providers and making those provider networks more visible to patients who might be seeking them. And then the plan offers different appendices. I'm going to go through these really briefly. But they're just exciting because they are highlighting tribes and tribal clinics that are already doing really incredible work. So for instance, in Siletz, the tribal ID doesn't have gender on it at all, which makes it incredibly affirming for anyone who might be transitioning or gender diverse in some other way. The Oklahoma City Indian Clinic has worked within their EHR to create an organ inventory. So this is really best practice care for gender diverse individuals, especially when it comes to preventative care, testing, and screening, because as you can see, individuals would get reminders for preventative care and for screening and tests based on the organs that they have and not based on assigned sex or gender identity. Both of those things can be misleading when we're thinking about what preventative care makes the most sense for someone. And I'll let Itai speak to sort of putting all this together in a few recommendations.
Thank you. So some of the higher level recommendations that we make is, one, to understand that Two-Spirit identity is not linear. It's not formulaic. As Morgan said earlier, it cannot be mapped along the signposts that we associate with the Western LGBT spectrum, right? So they're not the same things. We can't just do a one-to-one comparison. And that's really critical when your intake forms may be limited to those Western concepts, for example. Second, cultural connection is critical to identity and may be a protective factor. Again, we've talked a little bit in several different places about integration of culture. Even if you don't have the capacity to do that within your healthcare system, within your clinic, within your hospital setting, if you're working with a client, it may be helpful to ask questions about their connections to their culture, their connections to their community, and things associated with their culture that may give them strength personally. Also, the current models for gender affirming care present multiple barriers to providing affirming care. Yet, affirming clinicians manage not to allow this to affect patient experience. Okay. What we mean by this is that we know that you have to fit certain criteria in order to qualify, let's say with a third-party insurer, to have gender affirming procedures paid for, right? You might need a diagnosis like gender dysphoria. This presents in so many different ways. And it may be the case that one individual client may not really see themselves as particularly dysphoric, but we know that we have to satisfy that criteria in order for the insurance to pay for it. And so rather than communicating that in a way like assigning a diagnosis that can be stigmatizing, you could have a conversation with the client and say, look, this is the system we're working in. This is one of the requirements, right? So me, in order to advocate for you, I'm going to have to put this down, but understand between the two of us that this is something that is required of this particular system at this moment, right? Communicating that, understand that the system is limited and influenced by those Western assumptions.
Thanks, Itai. And I have just a few resources that I'm going to share with you, and then we'll be done. So if there are any questions on your mind, feel free to start thinking about those or putting them in the little questions spot. And before I share those resources, Itai had mentioned that we had good news on the policy front, and I did just want to share that the strategic plan that we just went over with you all was recently supported by resolutions, first from the Northwest Portland Area Indian Health Board earlier this year in April. That was followed by a resolution from the affiliated tribes of Northwest Indians. And then most recently, just a couple months ago, the National Congress of American Indians, so a national organization of tribal leaders, also passed a resolution in support of the strategic plan, which is the first time, to my knowledge, that a resolution in support of gender affirming care has been passed by that specific organization. And this is especially exciting and affirming, I think, given the fact that we've seen like attacks on gender affirming care at a state level in terms of legislation, and just really speaks to the commitment of community members, tribal leaders, and advocates and clinicians within Indigenous communities to ensure that this type of care is accessible for all Indigenous people. And then the resources that we have, if you are interested in staying connected with this work, one way to do so is to text 2S LGBTQ to 97779, and that just links you into a text campaign. We send out about one text a week with whatever is new in our world and exciting TwoSpirit and LGBTQ+ art and other opportunities. And you are also able to respond to texts and so to ask questions directly of any of us via that texting service. And then last, we have a trans and gender affirming care ECHO. So if you're not familiar with the ECHO model, it is a distance learning model for clinicians, and clinicians come together, in this case, twice a month.
Your microphone went out for a moment. If you can repeat the thing about the ECHO.
Oh, great. Okay, thanks, Itai. So we have a trans and gender affirming care ECHO, and the ECHO meets twice a month, and clinicians come together to discuss a case that one clinician brings, and this is any client or patient about which they have questions or if they want feedback on care. The cases are anonymous, and then the ECHO group discusses them and offers specific recommendations. And the ECHOs are led, in this case, by expert clinicians in gender affirming care. And we have a really incredible faculty team. So if you're interested, the bit.ly link for that is at the bottom of the slide, and you'd be welcome to join us on those calls. And with that, I will close, and we will open for questions.
Thank you so much for sharing all that information with us today. Please write your questions on the questions menu. Any questions or comments are welcome. And while you are typing your questions, let's go over some items to keep in mind. After the webinar, we will email you the instructions on how to get your certificate and the link for our YouTube video page, and how to watch our recorded videos via our YouTube channel. Please claim your certificate to complete the program evaluation. It will just take a moment, and it will be of great help to us. Remember, the activity code expires in 1 week. I'm going to show it to you again. The webinar is being recorded, and it will be available on our YouTube channel. We will email you this link to you. And feel free to reach out to me or our office if you have any questions or concerns. We'll be happy to be of assistance. Again, this is the website to claim your certificate, www.eeds.com. This is the activity code. Please write it down for your records. We also have the QR code if you want to access the page right after the webinar. And let's start with the comments and questions. we have a attendee asking if they can get the link to the echo once more, please. So I'll send the screen to you, Morgan, and if you can show them that slide again, that would be great. There we go.
I also just dropped it in the chat. There we go. Now it's full screen. But I also dropped a link in the chat to more information about the ECHO, which has the registration embedded as well.
Perfect. Perfect. So check on the chat and you'll find the link there. Thanks for sharing that, Morgan. Do we have any other question? I can see only comments expressing thanks and for sharing all this information. I will take the screen again so everybody can write down the code in case they need it. So here we go. This is the code, and please write it down for your records or use a QR code. And yeah, we don't have more questions. So, but remember, if you come up with any question, feel free to send it to our email address and we'll make sure that you get a reply. And now I'm so happy to thank our speakers for sharing your time and knowledge with us. Thanks to all the attendees for participating today. And we have now completed the session and you may disconnect. Have a wonderful day. Thank you, everybody. Goodbye.